It's where you go to bike, hike, and stroll miles of pathways over more than 7,000 acres of parkland. A place to go explore rivers and fish their bountiful waters. Natural places to go marvel at magnificent wildlife while you play outdoors and go wander charming communities. Find all this and more at Destination Downriver. Give it a go.
Today's podcast is presented by MarketInsights.us, with the podcast on YouTube produced by the City of Taylor's Media Center. Thank you for the generous support of our community sponsor. When your destination is beyond Downriver, let Martinson Family of Funeral Homes help you and your family. With locations in Trenton, Allen Park, Mabee, Rockwood, and Monroe, their staff is available 24/7 at 734-671-5400. For more information, visit martinson.com. Thank you to our team sponsor, Allegra Marketing, Print, and Design. Let Allegra assist you with your print, mail, design, and signs. Located in Wyandotte, and call 734-288-8994.
Welcome to the June Destination Downriver vodcast. I'm your host, Carl Zymak. Today we'll be discussing the convergence between community healthcare and prosperity. Our experience coming out of the COVID-19 pandemic demonstrated that health plays an increasingly important role in the economy. Healthier communities bounce back faster than unhealthier ones because they have faster job, population, and income growth. This is particularly important for areas still focused on recovering from the economic shocks such as the pandemic or even industrial transitions like the Downriver region has experienced. Decades of research have linked health and the economy. Healthy communities equal a healthy economy. A recent Blue Cross Blue Shield Health Index shows that healthier counties around the country have a higher capital income, average annual pay, GDP per capita, and lower unemployment. Downriver leaders are recognizing the connection between economic and resident health. The impetus is clear. Health is not only just a matter of access to medical care, though prevention and treatment are factors in good health, but also a function of the broader environment that affects residents. In this episode of our Destination Downriver podcast, we'll explore why a healthier community equals a strong local economy with Downriver YMCA Executive Director Jeff McIntyre and Rand O'Leary, President of Henry Ford Wyandotte Hospital. Welcome back to Destination Downriver, our June edition here with Jeff McIntyre, Executive Director of the Downriver Family YMCA, Rand O'Leary, President of Henry Ford Wyandotte Hospital. Let's talk a little bit about you first, Jeff. You've been a lifelong Downriver resident. You've spent the last 18 years with the Y here downriver. You've been an executive director since 2016. Under your leadership at the Y, it's continued to provide quality programs and services to communities throughout the region. Jeff's team places a heavy emphasis on community partnerships that extend their organization's reach. Their most recent partnerships have resulted in providing programs such as video production for teens and summer camp options for kids impacted by cognitive disabilities.
Absolutely.
That's you got a lot going on.
Yeah, today's the first day of summer camp.
Yes, so. You mentioned that to me before we came on. Congratulations
Thank
for
you.
having all those kids at the same time.
Absolutely. Yeah. Wouldn't have it any other way.
I hear you. Rand is an accomplished healthcare executive with over 25 years of experience within complex and matrixed organizations, including large integrated health systems, community and academic organizations. That, in and of itself, is a mouthful. Rand, you've been all over the place, and you were telling me that your kids are working in Dearborn at the Dearborn Public Schools, and you're really glad to be back in Wyandotte now.
Yes, thank you for having me, and yes, it's I'm very happy to be back in Wyandotte. We do have a daughter and a son-in-law who both work and teach in Dearborn, and recently welcomed our 6th grandchild, which was born at Henry Ford Wyandotte. So we're happy to be home.
The only way it had to happen, right?
Sometimes it happens that way. Yes.
All right. Well, let's get into our discussion here. Jeff, I'm going to start with you. Your organization has been in operation since 1941, but has never been as multifaceted as it is today. You're based in Southgate, but you serve the entire region, very large region down here, Downriver. Can you tell us about your regional footprint with the Downriver Y?
Absolutely.
Okay.
So for us, as you mentioned, we've been in business downriver since 1941. So we started over in Wyandotte, so over where Rand's place is there. A lot of great years there, and then obviously for the past 20 years here in Southgate. So during that time, obviously a lot of our membership and reach would really be Southgate and Wyandotte. So we've made a concerted effort this year to really reach out into different communities. So we're actually going to multiple communities this year. We hope to hit all 18 downriver communities and meet with all the administration and find out where those gaps are, or maybe we can bring program to some of the different cities that maybe have challenges in getting to the Y. So we really want to be the Downriver's YMCA, and that's really who we are.
What are you seeing as far as gaps go so far? I know embryo process here, walking through all these communities.
Absolutely. We've met with about 7 communities to date, and we're seeing a lot of different things, to be honest with you. Some of the similar is access to pools, water therapy. There's not a lot of pools downriver currently. We're seeing a lot of, especially some of the communities further north, further south, transportation is an issue in getting to the YMCA. So a lot of budgets have been cut over the years as well. You talk to different city managers, administrators, and they're telling us the same things. You know, we all struggled with COVID. COVID happened, it's a thing, it's still a thing today, as I'm sure Rand and his team will tell you. But for us, you know, getting past COVID and seeing what we can do now, you know, as opposed to pre-COVID, has been very huge for us. And we're seeing that these cities are also in a recovery mode. So for them, they may not have the resources to offer some programs that they would like to offer for their residents and for their community. So that's where maybe we can come in as a YMCA to where we can bring those programs to them.
Rand, while healthcare and access to it have long been recognized as a key aspect in economic success, investment decisions around healthcare have often been evaluated purely through the cost factors.
Right.
They really haven't been looked at as an investment with an economic return. How do we go about making health a part of the economic growth discussions in our communities?
Well, you know, I think the pandemic taught us a lot of lessons, and I agree, it certainly is not behind us at this point. I mean, COVID is still very much a part of our lives and everything that we're doing. We hope we're doing the right things to keep COVID in check and that it doesn't become a national issue again. But I think COVID taught us a lot of things about our healthcare system. Number one, the hospital, in this case, Henry Ford Wyandotte in Brownstown, is a major economic engine for the community. We have 2,300 employees. We have over 600 physicians on our medical staff. We service literally thousands and thousands of patients every year, either through the hospital or our outpatient facilities or our surgical services program or our emergency rooms. So these are all folks that live in the Downriver community. They live here, they work here, they contribute to the community. All of our employees contribute to the community. So there's an economic calculation there that healthcare puts back into the community, in this case, the Downriver area. So I think we learned through the pandemic, not that we ever took for granted what we have for healthcare services downriver, but more than ever it became, I guess the importance of that became relatively clear. You know, we had a pandemic. You know, we have to remember 2019, you know, COVID was new. It was something that was overseas, probably wasn't going to come over here in any great numbers. There was no vaccine. There wasn't a good understanding of even how to prepare for a pandemic. So when the pandemic, you know, really in early 2020 moved into the United States, we really learned the value of what it means to have a good, solid local healthcare system that's integrated into another larger system like the Henry Ford Health System. I really don't know where we would have been as a country if we did not have our healthcare systems at the ready to hospitalize those patients, to care for them, to communicate information to the community, to distribute the vaccine once it became available. Because remember, early on, there was no vaccine. We didn't understand even how the virus was transmitted from person to person. There was a lot of fear in the community. And where did they go for their information? They went to their health system. They went to their local hospital to help them understand what was happening and more importantly, how we were going to respond to it. So you can't put dollars on all of those things, but you can certainly underscore the importance of having a robust hospital that's part of an integrated healthcare system in your community. So I like to think that we feel much more maybe safe, and we feel fortunate to have Henry Ford, Wyandotte, and Brownstown in these communities going forward.
Jeff, institutions like the Y help our region to have an integrated approach to health management. How does the YMCA help communities find a balance of environmental, behavioral, health, preventative care that work alongside acute treatments from places like Henry Ford Hospital?
I think for us, it's a lot about access to healthy living, healthy lifestyles. So for us at the Y, we pride ourselves on being a place for all. And so how do we make that happen? We make that happen through a few different mediums. One of those is through our Make Every Day Better campaign. Downriver, I'm a lifelong Downriver resident. I know how hardworking the Downriver community is, and those extra dollars sometimes just aren't there. And so, taking that and finding a way to make sure that we can make sure those families can come in and enjoy and be healthy, and hopefully not end up in the hospital too often. That's the key. So breaking down those barriers and raising the dollars and giving out the scholarship dollars and ensuring that all the families have equal access to multitude of programs. And we're not talking just kids programs, we're talking adult programs, we're talking senior programs. We're talking summer day camp, which I mentioned just kicked off today for us as we record this. So for us, it's mainly about getting people in the doors and realizing how important it is to come and enjoy a healthy lifestyle, but also do it with your entire family. And that's where we like to try to separate ourselves from other quote-unquote gyms. One of the big things that people a lot of times will look at and say, well, the Y is a gym, it's a community center. And we have a lot of those facets, absolutely. But for us, we really are a place where people can come together and belong. And we've been doing that for 82 years now downriver. And in southeastern Michigan, we've been doing that for in our 171st year now, and doing that in southeastern Michigan. So being a place not only in the downriver community, which is what we're talking about today, but also in southeastern Michigan, and being that beacon, and obviously the Y is an organization, great reputation. We work very hard at that, and we make sure that families understand that this is a place that you can come and you can be healthy and you can establish those habits. So that way, when time does come, when maybe you do have to visit the doctor, you get a better checkup from your doctor.
Sure. During the pandemic, so many people. There were certain amounts of eye openers when it came to things that you didn't think of before. A lot of people were so cooped up, and they wanted to do anything. People who complained about the weather in Michigan, it's too cold, it's too this, it's too that. All of a sudden it wasn't too cold and you'd eat outside in the wintertime and things like that. Did you see an influx after the pandemic loosened up in places like the Y, people coming back out and wanting to get involved?
For us, we were one of the first local organizations downriver to start to run certain programming. Like youth sports is one that comes to mind. So we did see that there was a thirst, and people did want to get out, and they did want to reconvene, and they did want to be healthy. At the height of the pandemic, a lot of businesses suffered. Similar to the YMCA, we lost 60% of our membership at the height of the pandemic, and obviously people were scared. People were staying home, and health wasn't necessarily at the top of I know the pandemic was a health thing. We're staying home because of that, but coming out of the pandemic, we are still in a recovery mode. People are still. But we're seeing over the last couple years now that we've gotten past quote unquote the thick of it, that people are wanting to come back out, and we're seeing that at the YMCA as well, and more people are coming back and enjoying activities like they did pre-COVID.
Sure. Rand, while Jeff and the Y almost always see their participants in person, doctors are often seeing participants virtually now. How much has the virtual treatment progressed over the time period here as another method of broadening healthcare access?
Yeah, it was absolutely critical, and access was, we share that, access to our services is absolutely important. Folks need to see their doctor, and during the pandemic, we also experienced a close down, if you will, of surgical services, doctors' offices, things were closing down, but patients still needed access to their doctor. So access is, again, one of our important goals is to improve access. And when I look at the pandemic, there are things that changed. Some are temporary and some are permanent. Prior to the pandemic, it was not, I'll say it was very unusual for a patient to say, I'd rather see my physician over my computer or on my portable device or my phone. It just wasn't socially acceptable to see your doctor in that way, or even to feel that you were getting adequate health care that way. So the pandemic, in early 2020 or early 20 becomes, large, widespread, coast to coast, things shut down. Now instead of being able to go in and see my physician, I have to see them on my portable device. So all of a sudden now, rapid adoption cycle, right? We go from maybe 5% of our patients using that technology to 65% of our patients seeing their doctor that way, because they still needed access to care. The Downriver communities, I don't think it's a secret, it's an aging population in some areas, and they have, there's chronic illness, there's patients that need to be cared for and they need to be treated. So this became one of the only ways that you could see your doctor and continue your care. So now, after the pandemic, we did, start to, revert to some of the previous patterns, but we're still seeing roughly 15% of our patients that through that telehealth type service. I think that's the future. I think that will continue to grow. I have 3 adult children, all in their 20s and 30s, and I don't think they want to necessarily access healthcare the way I did, and my generation did. I think they're going to want options, and so the future is going to be more virtual interactions with your provider, maybe through your phone or through another electronic device, and I think that will become a very acceptable way to get high quality health care versus going in and necessarily having that face-to-face encounter with your physician.
So it's a good thing.
I think it's a good thing because we are, struggling across the country right now with shortages in all key medical specialties, including physicians. The pandemic accelerated retirements in a lot of our medical specialties. Nurses and doctors who were within a few years decided, maybe they would retire now. It changed the perspective around healthcare in some good ways and maybe some ways that are a challenge. So the future will be one where we're trying to continue to stretch a fairly limited resource, but treat an aging population and a population that's still growing in its need for health care. So it's another tool and it's another technique for us to deliver health care. It won't necessarily work for everyone, but for, I think, a lot of folks, it'd be a very good option for them.
Is that issue our most pressing healthcare challenge right now?
The labor shortages and things. It is because prior to the pandemic, I don't know that everyone remembers this, but there was a evolving nursing shortage prior to COVID. That didn't get better during COVID. It actually got a little bit worse. We're not graduating enough nurses. I face this issue not just in Michigan, but places I've been other than Michigan. We're just not graduating enough nurses to meet the demand. There's not enough schools, there's not enough programs, there's not enough clinical sites of care, there's not enough instructors. So we have to get very creative in how we're training the next generation of healthcare workers, number one. Number two, we have to find other ways to deliver care to patients that will meet their needs because they still need to have their healthcare needs met. You've probably heard a lot, lately about artificial intelligence and what's the future of that. I think there's a place for that in medicine to help extend and broaden the reach of our medical staff and our physicians because there is a physician shortage as well across the country. So these shortages will be with us for the foreseeable future, but patients still need care. Patients still go to the emergency room, they have babies, they have surgery, they have all those things that will continue, and we just have to find ways to be more creative in our reach and make sure that we deliver quality care to those patients.
Jeff, the old saying goes that prevention is better than the cure sometime, okay? What sort of member programs are really favorites when it comes to the YMCA and those kind of choices when it comes to preventative care, keeping people active, that type of thing?
Sure. I'll circle back to something Rand just touched on, the aging population downriver. Throughout the pandemic, it was an interesting fact that we now have 47% of our current membership base is senior-based. And it's one of our biggest groups of members, obviously. And so a lot of the programs associated with seniors, when it comes to water exercise, when it comes to chair exercise, things that they can do that doesn't necessarily require a lot of mobility, things of that nature. So we are seeing that definitely at the Y as well. We're also seeing some of the staff shortages, like Rand touched on, national lifeguard shortage.
Right.
Finding enough guards to guard the pool, and we're still working towards getting back to our full operational hours pre-COVID. For that very reason, from a staffing standpoint. So we are seeing that, and in terms of programs at the Y, we really like to bring in partners as well. So we're going to do all the programs at the Y that we normally do and that we're really good at: swim lessons, youth sports, exercise, childcare, you name it. We're going to do that still. But for us, how can we expand our reach, and how can we bring partners into the Y from maybe an informational standpoint? We have worked with certain hospitals as well, Henry Ford being one of them, where we would have people come in and educate our members because the members are there. It's a captive audience. They're people that do want to be healthy. They want to be active, but they don't necessarily have all the information. So that's why they're coming to see us. So can we bring in a physician to talk about nutrition? Can we bring in a physician to talk about ways that they can stay healthy? And so continuing to look for opportunities such as that, that's why we're so excited to really reach out to the different municipalities and find out where those challenges may be in their communities, and how we can be a organization that can help solve that.
Has the Y always reached out to the medical community and tried to be a partner with them, or has this aging population really expedited a lot of that?
We were doing that pre-pandemic, and I think I can only speak for the Downriver Y, but I know a lot of other Ys in Metro Detroit also have relationships with healthcare organizations, because the two go hand in hand. For us specifically at Downriver, we've had a clinic right within our YMCA, a rehabilitation clinic. No longer the case now, but that was a natural fit that we had at the time. So reaching out to the medical community is huge. We have a lot of people that come to us all the time and say, my doctor said I need to be more active, or my doctor suggested I come and take your water exercise class. So there always has been that relationship, and I think that that's not anything that's going to change anytime soon, at least on our end.
Are you, Rand, when it comes, as we head toward the wire on this episode, let's return to the pandemic for a minute. How are systems like Henry Ford Health and other health institutions positioning for that next national and worldwide crisis? Are there specific steps that you're going through on a regular basis?
Yeah, one thing I just want to pick up on something that Jeff said is that healthcare isn't just the healthcare that's delivered within the four walls of the hospital, or the emergency room, or the operating rooms, or even the primary care practices. A lot of it is delivered there, but it's also living healthy and being healthy in your community. And that's really where the YMCA is really a valuable partner for us, because patients do want to know, how can I eat healthier, how can I exercise more, how can I access services? I know that the YMCA used to, and I'm sure you still do, offer a lot of educational classes as well. And so our patients do look for those services in the community so they can follow the plan that's been laid out by their physician. So to answer your the question that you just posed, let's just hope, they say the pandemic is once in 100 years. Let's just hope that that's accurate. But I think we've learned a lot during the pandemic. First thing I would say, the very first lesson we learned was the value of communication. If we think back, as I mentioned earlier, 2019, early 2020, information was really difficult to get, on COVID. What was it? How did it transmit? Was it aerosol? Was it touch? Was it, what was it? There was information coming out that sometimes conflicted previous information. That made a lot of our community members anxious because they didn't, know what to believe. Information changed frequently. So I think the value of having good, clear, consistent communication early on is really important. I think we also learned a very important lesson about how fragile our supply chain was in healthcare.
Yes.
We had come, like most of us, that use Amazon or other services, we want it now, we want it tomorrow. And so healthcare had, really followed that just-in-time inventory model as well. We really counted on those deliveries coming in every day. So when the supply chain became disrupted, we started having critical shortages of supplies. Masks were in short supply, hand sanitizer, vaccines, everything was in short supply. So we've got to, reinvest and bolster our supply chain, which the Henry Ford Health System is doing, so that we can ride out disruptions in the supply chain if those were to occur again. I think we really learned, as I said earlier, the value of our health organization, not just Wyandotte, but the value of being a part of a larger system that can leverage their strengths across a large geographic area, which we found here when it came time to distribute the vaccine, and you've got to vaccinate hundreds of thousands of people. You really need a very large system to do that, and everybody focused on that single task. So I would think that, those are some of the lessons we've learned. I think overall our preparedness plan was pretty solid because we prepare for things like this all year long. We drill, we do all kinds of things to make sure that we're ready, but we didn't necessarily count on the disruptions that were going to occur that would kind of get in the way of even the best planning. The good news is now we're much more prepared. Should we, heaven forbid, ever enter into another pandemic like we just experienced, we'd be far more prepared for that, and I think we would be able to respond far more quickly.
It's interesting you brought up the communications component, and that was fascinating when you didn't have to live it. I think when you could look back on it, the changes in what was being said, something comes out and, well, we're going to do it this way, and 2 weeks later, well, we decided we're not going to do it that way, we're going to change it. And it seemed like Americans gave the medical community a lot less rope when it came to changing on the run. I don't know whether that's really fair. In fact, I don't think it's fair at all, because, like you said, things do change, and they change quickly, especially during a pandemic like that.
Yeah, I think we have to think too a little bit about the environment we were in at that time. Unfortunately, there was a little politicizing, that was going on, and some things that were out of our control. There was federal communication, there was statewide communication. Sometimes those conflicted. The health system was put in the middle of trying to explain, to the public what was happening. Just being in health care, I think our commitment was we're going to tell you everything we know when we know it, but understanding that it might change even within the same day, because we were really learning. I think if you talk to our medical staff, particularly our epidemiologists, they would tell you we're still studying viruses from 70 to 100 years ago, trying to understand them. This virus is brand new, and we knew very, very little about it. So information was going to be sometimes not clear, sometimes not inconsistent, but we were all trying to do the same thing, rapidly respond and make sure that we can ensure the safety of the public. And so if we look back, I think historians will study this time period for decades to come to understand what went well and where were the challenges. But we've really worked hard to incorporate all the lessons learned into our emergency preparedness plan, and now we drill on a regular basis to that plan. So we are far more prepared than we were before, but let's just hope we don't have to use that plan.
I agree with you 100%. Jeff, anything you want to add?
No, I had a minor outpatient procedure at the height of COVID, and at Henry Ford Wyandotte. So I just want to, the team over there did a fantastic job. So obviously, if, as Rand was mentioning, if something were to happen again, these guys are on top of their ball game, and we can't thank our health professionals enough downriver. All of them, they did a fantastic job throughout the pandemic, and the YMCA. We like to feel we play a small part in that. maybe a bigger part. Who knows? We got members that come and use our place every single day, and it's not just. And we talk health in terms of obviously being healthy in the body and things, but at the Y, we're spirit, mind, and body. So we see a lot of people even coming out post-pandemic that were cooped up for so long, they're just yearning for socialization. Sure. And the socialization piece is another part of being healthy, and having those positive relationships and being able to interact with people once again. So just feel fortunate to be a part of that. Feel fortunate to be a part of making Downriver a better place, and doing our little part in hand with Rand and the health professionals.
Anything you want to add last minute here, Rand?
Yeah, I would just say that although it's been a challenging time, not only for healthcare but for really the entire country, there's never been a better time to be looking at healthcare careers. It's exciting. There's growth. The organization, the system across the country, it's under transformation. So it's an exciting time to be in healthcare. It's an exciting time to be a doctor or a nurse or a respiratory therapist or work in the cardiology department. There's lots of technology and there's lots of developments that are happening right now, and it's a great time to be in healthcare. The incentives have never been stronger, from a financial perspective, to be in healthcare. I've been in healthcare almost 40 years now. It's, we used to say it's a calling, it's a passion, it comes from the heart. And if you're the type of person that really likes to give back, and particularly to serve people who are vulnerable, and nobody's more vulnerable when they're sick, and you have a giving heart, it's a great career, and I've enjoyed it for almost 40 years. And I would encourage anyone who's interested to please look at healthcare as a career choice.
Fantastic. A great way to sum up this discussion. Gentlemen, great discussion. We wish you luck and future successes, both at the Downriver YMCA and Henry Ford Wyandotte Hospital. For Jeff McIntyre, Rand O'Leary, I'm Carl Zymak. Thanks for joining us on this episode of Destination Downriver. We'll see you next in July.
Thank you again to our sponsors, Martinson Family of Funeral Homes and Allegra Marketing, with a special thanks to our production partners here at the new Taylor Media Center. Thanks for listening and watching. Please visit our website, destinationdownriver.com, or our Facebook page, and be sure to join us for next month's podcast.